Good morning, everyone. It's great to see you at this morning session about healthier patients, greener patients. I'm delighted to welcome you to this session supported by AstraZeneca and a Partnership for Health System Sustainability and Resilience for this session where we're going to discuss decarbonizing care pathways for people and planet. We really hope this morning to have an interactive session on this very important topic, which is very timely given the environmental and demographic changes that we're living, but also given the start of the new mandate in Brussels, where also from an institutional perspective, we do hope that these questions end up as priorities very high on their agenda. So my name is Elisabeth Kuiper. I'm Associate Director at the European Policy Centre, a Brussels-based think tank, and I'm delighted to have with us this morning a great set of panelists with expertise that will come in very timely this morning. And I start with you, Tonya. Tonya Weiners, President of Global Allergy and Airways Patient Platform. I think it's very important to start indeed with the patients, so it's great to have you with us, Tonya, this morning. Then we have Will Clark, Executive Director of Healthcare Without Harm. It's really good to have you with us as well this morning, Will. Then we have Joseph Figueiras. I don't think really that I need to introduce you, but as always, it's good to have you with us as Director and Co-founder of the European Observatory on Health Systems and Policies. And last, we have Andrea Mugen, Area Vice President for Western and Southern Europe at AstraZeneca. And as I said, this session will concentrate on the need to create sustainable care pathways to improve patient outcomes while reducing the environmental impact of healthcare systems at the same time. And I'm sure that our speakers will also speak about it, so it's not so much a session where as such we're going to speak about the environmental footprint of the healthcare sector, but really we would like to speak about making healthcare systems more sustainable and focus on patient outcomes in that respect. And I already alluded to the immediate urgency to do that, given environmental and demographic changes, and the importance to innovate our healthcare models. And I'd say there are three things that we would need to focus on, and where also I'm really looking forward to your input as an audience. Because we need to prioritize prevention, early diagnosis, and precision medicines, because these we need to address the challenges of the future and to work towards a more sustainable future. So in this session, we will start first exploring, of course, what it really means to understand the issues at stake, but also, given the expertise of our panelists, we really would like to explore best practices and to speak about solutions. And again, I think this is a very timely moment because in Brussels we know that the next European Commission is preparing for the next mandate. We're looking forward to the hearings in the European Parliament that will be held early November, and where I'm sure that also the nexus between the environment and health will be very high on the agenda. So our goal today is really to identify strategies that can help decarbonize the patient care pathway through early and targeted interventions. And I'm confident that the insight that we share today will not only enlighten us, but also inspire actionable next steps. And as I said, we do also count on you as the audience. So we will ask you to come in at several instances, not just at the end, but also really in between the blocks that we have prepared together with the speakers. So please already reflect on your questions, because I think it's much more interesting if we make this an interactive exchange than just an exchange with the panelists. And in order to make the session interactive, I propose that we start with a poll where we have 3 questions. And I also would like to introduce, in that context, our Jon Gastein colleague, Beatrice. It's really great to have you with us. I think it's also important to mention that the European Health Forum Gastein is a context where we would like to be inclusive for all generations. So Beatrice, it's great to have you with us. And you also will help us look online, but also indeed look for the questions of participants in the audience online. So perhaps can I ask our technical staff to get the poll online, because I know that we have 3 questions. And indeed, I think you know the drill. Please scan the QR code and go to Slido and answer the 3 questions. And I believe while you do that, I can already ask if I can get the first question up. And I'm going to read it for all of you, because the question reads, if the healthcare sector was a country, where would it rank among the largest emitters of greenhouse gas globally? And of course, there's but one right answer. And let me see, because I believe indeed that people are still coming in, because I see there's still changes on the screen. So I give you a few more seconds for those of you that haven't found Slido yet. Yes, still a few last answers coming in. It's a hard one. And especially given the question focuses on the effects globally, I can only imagine that's perhaps going to be surprising and not in a positive way for some of you. So I think we're getting there, because I think the answers are pretty static at some point. So the answer is, so if the healthcare sector was a country, it would rank among the 5th of the largest emitter of greenhouse gases globally. So I think that tells you something about the urgency of today's session. Perhaps we can go to the second question then. Air pollution is the question mark leading global risk factor for death. So what's the percentage that comes to mind when you speak about the risk factor for death globally speaking? The answer is, it's the second, so it's 58%. Also, again, the highest score, as you can see. So that's pretty appalling. The third question. What percentage of global greenhouse gas emissions is the healthcare sector responsible for? Considering aviation accounts for 2.5% of global CO2 emissions. So what percentage are we speaking about? I think this is perhaps the only question where luckily it's not the highest, but still it's answer B, which is, it should be 5%, I've been told. So that's still the first one then. So again, all the answers, so it's not actually answer B, but it's action A as well. So all the answers show you that indeed there is much urgency to speak indeed about the topic of healthier patients and greener patients. So perhaps with that, I think that's an excellent introduction to indeed our panel. And for that, I'm going to sit in order to be the same height as my panelists. And perhaps indeed, Tonya, let me start with you, because I think from a patient perspective, where it's important to touch on that first. Can you explain also your experience in fragmented care and how that influences health and patient outcomes? How indeed chronic conditions are not affected only by indeed environmental change, but also by indeed more fragmented healthcare services?
Sure, thank you so much, and thanks for the opportunity to be here. So I think, again, my frame of reference is respiratory disease. It's where I've spent over 25 years of my professional life and my personal life as a patient advocate. And in respiratory care specifically, we see a very fragmented patient journey, oftentimes leading to 5 to 10 years of symptoms before getting official diagnosis in conditions like asthma or COPD. And even further delays in access to quality care and appropriate levels of care when uncontrolled symptoms exist. So a person may be managed by their primary care provider, but as primary care and general practice has also become more fragmented, it's more challenging for patients to get that timely diagnosis and access to care. Consequently, we see more flares of respiratory conditions like asthma and COPD, resulting in hospitalizations, unplanned office visits, missed work days from school or work, certainly impacting, again, individuals at a personal level, but also society at a broader level. So it's that fragmentation of care across respiratory disease that I think we have to address, and especially when it comes to the environment, because we know that a well-managed, well-controlled respiratory patient is the greenest patient. The inhaler that a person will use routinely is the greenest inhaler, because so much of that environmental footprint comes from those hospitalizations and readmissions.
Well, thanks so much for that, Tony. I think that's a very important starting point. And that is only indeed to speak about the healthcare system, because I think we also know, and we have learned from other sessions also yesterday, how, for example, also our policies to do with housing and broader areas indeed really influence citizens and patients. But I think today, and I think that brings me to the question to you, Joseph, because I know that indeed from an observatory perspective, you are working, I think, both on the carbon footprint of the healthcare sector, exactly, as well as the more refined topic that we're discussing today, which really is indeed about fragmented healthcare systems and indeed how we can improve them in a more sustainable way. So when it comes to prevention, telemedicine, the appropriate use of diagnostics and pharmaceuticals, how would you see that from a policy perspective? Because you're working on policy recommendations to the institutions.
Yes, yes.
How do you see these things?
I think it's important at this stage, if I may, to thresh out some possible confusion. Yesterday I was talking to Dimi Pantelli, Beatrice Dorby, who are working in my team in this area. Separate what is adaptation, which is effectively your patients get much worse with the environment. The environment is not the cause, but it's worse. It is the cause and worsening. And what the health system can do to adapt and to address all these elements, heat waves, new pathogens. This is a very important element. I'm making very basic thresh out of issues here for all of you who are experts more than I am. But in my job, in knowledge brokering, working with member states, with policymakers, it's very important that we thresh out these issues very clearly. So one is the adaptation, and the second is how do we reduce climate mitigation, how we reduce the impact of the health system into the greenhouses, into the carbon footprint. There we have a whole debate on greening, on hospital greening, reducing. But then I think I like to congratulate you, AstraZeneca, for putting this on the table, is the aspect of reducing the use of services, because if you have less services, there's going to be less gases. And by preventing, we can talk about prevention in a minute, but value-based care, there's lots of waste, lots of duplication, and by more effective use of services. We were saying beautifully, Tonya, about a much better management of asthma and COPD. We manage these patients very badly, lots of expensive use of resources, and lots of greenhouse impact. So would you like me to thresh out those a tiny bit, maybe, on the...
Perhaps just a few examples,
Just examples. Look, prevention. You can have the cake and eat it. You can have the cake and eat it. Urban health pathways, bicycle pathways like in your country, is good for health. I know it's not rocket science, I know. But we need to talk about that. It's good for health and it's bloody good for the environment. It's such a powerful case that health systems can make for the environment. Proteins. Zenib Orr, we finished a big study now about the co-benefits. She's making a great paper about animal versus vegetal protein. It's great for health, prevention, and the impact of CO2 footprint of beef and pork compared with soya, it's enormous, even when you account for use of water and so on and so forth. Two, the whole area of value-based waste. I mean, we know that at least a third of the things we do to our patients, to your patients, is even harmful, not effective. So can we have the cake and eat it? Can we do it both? Inappropriate use of pharmaceuticals. Pharmaceuticals is a source of is a necessary source, but not always our use of pharmaceuticals is appropriate. The packaging of pharmaceuticals. Why don't we get to an approach to package the pharmaceuticals for dosage as the UK needs? So we reduce a lot of the waste of these pharmaceuticals. Duplication of diagnostic tests. And then the whole area, and I'll stop here, on the organizational approaches, the pathways, the decentralization. Let's be cautious though. Decentralizing PHC, community-based, has lower impact on the environment, but it's not always necessary. Sometimes for certain interventions, you have to centralize them. Let's be careful. Digital, telemedicine, value for money, better outcomes, and decreasing. So the point, I'll leave it here perhaps later. What I'm very keen to talk about, if you wish, later on, is about the political economy, about how do we put these arguments to go to the health sector and say, you guys should give value for money and better outcomes, because on top, if you do that, you're going to be good for the environment. I think it's a very powerful political element to convince our policymakers, our providers, our doctors, our managers, and our patients. But let's do that for later, perhaps. I don't want to over-abuse my time.
Joseph, I think that's a very good point, and certainly also something that I think collectively we should come back to at the end, because this is the time indeed to formulate recommendations to policymakers. So let's spark that thought. And also thanks indeed for providing the broader context. But perhaps, Andrea, I would like to go back to you. And also go back indeed to the more specific, let's say, sustainable pathways for patients. And probably the audience have seen that indeed on purpose in this panel we put together both stakeholders representing the public as well as the private sector, because I think that's very much the spirit of Gastein, that we have this multi-stakeholder approach. So from your perspective, work at AstraZeneca, what are the biggest challenges that you face?
So I think some of the biggest challenges we face in the healthcare system today is that we still have very traditional approach to managing illness. So we tend to manage illness reactively, and we don't spend as much time talking about prevention, which we've just touched on. And we think about it as a kind of sick care. So those resources come later in the pathway, and that comes with a burden from a patient perspective, in addition to a burden from an economic perspective for the healthcare system, but also of an environmental perspective as well. And in the EU, about 80% of healthcare costs are actually on chronic disease management, and less than 3% is actually spent on prevention. So I think it's still under-recognized what you two are both talking about, which is the fact that if we can identify patients earlier, diagnose patients earlier, and treat them with guideline-directed care earlier, it's going to have a benefit from a patient, economy, and environment perspective. And one example that maybe is becoming a bit more clearer now is chronic kidney disease. So I think it's beginning to be more evidence that shows with chronic kidney disease patients, if we identify them earlier, they have a lower carbon footprint than if we do so later, particularly if these poor patients end up having to go to end-stage renal disease and end up on dialysis, because there's 250,000 patients in the EU on dialysis, unfortunately, and that's needed for their survival. And dialysis is associated with about 160 billion litres of water globally, and over 900,000 tons of mainly plastic waste. So that's a considerable impact from a carbon perspective. So I think that's one example. Lung health is another example, which is close to Tonya's heart, which we spoke to briefly. You know, COPD is a large burden on hospitals because of hospitalizations. And asthma is very common across the world. And there's evidence now to show that with asthma patients, a poor controlled asthma patient is 3 times more burden from a carbon perspective than a well-controlled. So I think at a time when we're thinking about policies, we really need to think about policies that have a win-win-win, a win for patients, a win for the healthcare system in terms of the economic impact, and also a win for the environment too.
Well, thanks, Andrea. And before I bring the audience in, let me perhaps bring you in, Will, because when we indeed speak about carbon literacy, I know that in your past, if I'm not mistaken, I think you have launched a program, Care Without Carbon, which I think is a very, telling name. And I think I'm very keen to hear from your perspective, working for Healthcare Without Harm, how you see what member states can do. Because I think it's very important also, if we speak about healthcare, to acknowledge, of course, that there's a role for the EU to play, but as much for member states to play. So can you perhaps introduce that to us?
Yeah, Care Without Carbon's a blast from the past. And actually, I'll begin my answer with an anecdote, if I may. So before I joined Healthcare Without Harm in 2018, I was a sustainability director in the National Health Service, the NHS, in the UK. And I remember this very clearly. The very first time I went in front of an NHS board of directors to talk about sustainability in a hospital, this was in 2010, and I got in front of the board and I said, there's a new mandate. Every NHS hospital has to have a sustainability plan. This is what it means, this is what it needs to look like, and this is how I can help you. the chief executive listened very, very carefully, and at the end of the, end of my presentation to him, he just paused and he said, look, here's the thing. If somebody comes into this boardroom with an issue, it's usually a clinical issue or an operational issue or a finance issue. It's something I understand as a clinician. This sustainability thing, I'm completely at sea. I have no idea how what this means for our organisation and how we should be integrating it. So I think the carbon literacy question really speaks to that. We shouldn't assume that people working in the health service implicitly understand the link between sustainability and core business. And the really important thing for me is that I think the health sector is unique in the sense that there is a seamless connection between the core business and sustainability and carbon reduction. Absolutely seamless. I mean, I challenge the audience to think of another sector where that connection is as strong. So, so it's partly about raising awareness, but it's partly, your question was about what member states can do. I mean, I think it's partly about planning. And I think it's about supporting healthcare organisations to make that journey, to make that transition. So, member states can plan for that. They can develop roadmaps. They can calculate their carbon footprints. They can invest in research. They can make capital investments, and they can support training and development of the workforce, either directly or through the curriculum. So I think there's an awful lot that can be done. But like I say, it comes back to let's not assume that those working in healthcare understand that connection. I think it's really important to bear that in mind.
And perhaps a very quick, because again, I think the answer can be very lengthy, but perhaps a very quick question, because we have been seeing also post-COVID that a lot of the EU budget also has been dedicated to addressing the twin digital and green transition. And of course, indeed, as you say, the healthcare sector is a very important sector. Have you seen, because we know that certain countries have indeed been dedicating a lot of their programs and their requests for money, for example, from the Recovery and Resilience Facility to work on exactly that. Do you have a few countries that come to mind where they have a lot of best practices to share?
Not really, and I think that's part of the problem, is I think we failed to make, at a policy level, failed to make the connection between, I completely agree with what these guys were saying, but we failed to make the connection between prevention and sustainability. They're still treated as two separate issues from a policy perspective, and I think that's the challenge for member states. It's also the challenge for the EU, I have to say, in terms of, as you say, thinking about how we invest in the resilience, strengthening health systems, pandemic preparedness. All of this has a sustainability benefit, and yet that connection just isn't being made strong enough, and it's something my organisation is working really hard on.
Thanks, Will. Tonya.
Yeah, I just thought of a best practice that is actually very relevant. So actually in both Poland and in the UK, they have instituted in asthma and COPD what we call time clock care pathways that actually say from the time a person is appropriately identified, diagnosed, that they should be seen by a specialist and have the appropriate diagnostics and workup and care plan in place within a 6 to 12 week period, depending on which country you're looking at. And then again, if a person is uncontrolled with severe asthma and seen by a center of excellence for severe asthma, they should initiate those personalized targeted treatments within 3 months of that initial workup. So again, having more definitive, what we call time clock care, I think gets the right treatment to the right patient at the right time, keeps them out of hospital, and again, is better for the environment as well as for that person.
But I guess that comes with a culture shift in the system as well. So in these cases, you mentioned Poland and the UK, was that from within the healthcare system, or who were the change makers?
It was. So it was the individuals in Poland, it was the pulmonary respirologist, the physician who leads that effort within their government and advancing that plan and path forward. And then it was the system actually putting flags in place in their electronic health records and ensuring that those patients, once recognized as uncontrolled, were accelerated along that care path.
Thanks so much. I'm looking to the audience to see if we already have some questions. Who would like to come in? Yes, I see a question. I think the mic is coming your way. And perhaps if you can briefly state your name and affiliation, I think that's always helpful for us to know.
Hello, thank you for the wonderful panel. I'm Shuti Cho from Taiwan, Taipei. Actually, about 12 years ago, we launched the Low Carbon Hospital Initiative in my country, and we realized if we only did those practices common to companies such as reducing energy consumption, etc., those things, if we only did those things, then the cut on our carbon emission actually is very limited. Without cutting healthcare burden, the reduction in our carbon emission is very limited. So it's wonderful to hear Joseph talking about so many different weapons specific to healthcare sector that we can apply to really make a big difference. For example, if we promote exclusive breastfeeding, then directly we reduce consumption of infant formula and the cans and the water, etc. And further, we prevent infection and then infant and mother disease, etc. So I think good quality healthcare is the green healthcare. So it's wonderful to hear the discussions here. And the other two flagship example would be the plant-based diet for prevention and for self-management of chronic diseases, and for active and green transportation to promote physical activities. So congratulations. I think you hold the keys to really make a big difference. Thank you.
May I ask you a question?
Yeah, please go.
I agree with you. Why is it not happening? Breastfeeding, I love this example. It's a beautiful example, and we all can go hours and hours and several sessions about breastfeeding, commercial determinants, and so on, and so on, and so on. But I like the beautiful additional elements. Listen, breastfeeding really has a huge impact in lowering carbon footprint. I love it. Why is not happening? Why this plan you had in your country 10 years down the line probably is still halfway on the carbon footprint of hospitals? Because it's a no-brainer. I mean, you were making it beautifully well. I mean, actually the NHS is making positive strides in that direction. I'd like to hear why the NHS is making positive strides in carbon neutrality. I like to hear, sorry, I don't want to take the job of a moderator. I apologize.
Do you want to react? Because again, if you want to briefly react, we then can go to Will afterwards.
Yeah, so Joseph, do you mean why it's not happening? No, actually it happened. In Taiwan, we doubled our exclusive breastfeeding rate by implementing the effective system-oriented interventions, by implementing policies and accreditation, etc., for our healthcare sector. But then, the political and commercial determinants came in. So then our infant formula companies, they interfered with some politicians, so they wanted us to hold our efforts on that. So very beautiful. So then the upstream is the commercial and political determinants of health. But we also would like to have, you see the measurement is improving. We would like to know, how do we give hospitals the credit for each one more exclusive breastfeeding they promote? What's the reduction on their carbon footprint? We would like to have that measurement so that we can better award them, especially under the ESG era. Thank you.
Well, thank you so much for bringing that global perspective. Perhaps, Will, did you want to react to that?
Really briefly. I mean, we could probably talk all day on the subject, but I think the NHS, there's a couple of things. One, I mean, every health system is different, which is an obvious thing to say, but it's one of the challenges we have when talking to system leaders about, decarbonising their health systems, and we can maybe come on to how we've dealt with that. In the NHS, very centralised system, which enables a very direct pathway in terms of policy making. The other thing to say is it's been doing this a long time. So I joined the NHS in 2010. the NHS started to do carbon management off the back of the Climate Change Act in the UK in 2008. So, I mean, this is nearly 20 years ago. So it's had a run-up. I mean, it's now committed to net zero by 2040 for direct emissions and 2045 for its whole carbon footprint. So I think it's the most ambitious carbon reduction target in a health system. But as I say, it's taken time to get there.
Thanks, Will. Beatrice, I'm going to go to you because the experience learns that usually online audiences are very active. So do you have a few questions from us from the online audience?
Yes, thank you, Elizabeth. We have some interesting questions from the online audience this morning. One which perhaps the panel has already touched upon briefly, but they might want to elaborate further on is what could be the 3 priority actions to achieve a sustainable health systems? And another question is, for a hospital interested in starting out the process of decarbonizing their care pathways, where do you recommend that they start? Is there any advice as to what they should prioritize tackling first? That's it from the online audience for now.
Thank you so much, Beatrice. I think Andrea, did I also see
I'll start,
Tanya?
and then maybe somebody can add to it. I think one of the things we've talked about already is generally this desire to try and get earlier diagnosis, earlier treatment, and then not have the same healthcare utilisation later down the line where it has more of a burden. But I think Will made a very good point, which is every healthcare system is different, and therefore the tangible solutions that need to be put in place are probably different within different healthcare systems. And that's why, the PHSSR, which I think some of you are probably aware of, which is the Partnership for Healthcare System Sustainability and Resilience, which was founded a number of years ago now by the World Economic Forum and AstraZeneca, and also the London School of Economics, and more partners now are coming on board, which is great. But this was the whole aim of that project, to really get healthcare systems to look from their own research at what are the areas in their system where they could look to make improvements. And on the back of that, there's policy recommendations that are very tangible for that healthcare system. And that's active now in about 30 countries globally, and we're beginning to see the impact of it on a local level. So I think it starts with number one, local healthcare systems wanting to do something about this, and then working with the experts locally. They've got the data, the academics locally, there's frameworks they can use to help go through this systematically, to find the opportunities to tackle this. And there will be some commonality. We talked about CKD, that's something that's coming out quite often, but there will be some unique aspects too.
Exactly.
Maybe, Joseph, you've got some... Tanya?
So you're nodding, Tonya.
Right. I was just going to say, I think a lot of it does begin with the awareness. I mean, yesterday was World Lung Day, and we released our first Lung Health for Life chronic respiratory disease report on the heels of 2 very important reports, the Global State of COPD report that was released at the European Respiratory Society this September, and the COPD Index. And so again, helping to give policymakers and advocates a baseline of what policies are currently in place and what the burden and issues may be. I think all of these reports that I just mentioned highlight the importance of, again, that triple aim of people, the environment, the planet, and economics. And I think we have to approach it from all 3 angles, because if we don't build the story first with the heart of emotion and people and their stories, and what really we're doing this for at the end of the day is to make people's lives better, without the evidence, the scientific evidence-based approaches for prevention, early diagnosis, and for quality standards of care. And then finally, the economics, because we know that all governments across the world are dealing with limited resources. So how do we help them and support this argument that this is going to make the most sense for all 3 of those stakeholder groups, and the triple aim of people, the planet, and government economics?
But it's difficult. It's difficult to, I'm totally behind you, of course, and it's taken such a long time, to change actually procedures, evidence-based medicine, increasing value-based care. So we hope that the environment element will help us, but it's taking time. Perhaps contradicting myself, and perhaps following what has been said, The greening hospitals elements, and I see my colleagues here in Austria, last year we were sharing a platform, Andrea in GOG, Finnish, NHS. The area where perhaps we can quickly get some results, and definitely the partnership is looking at that, is in the greening of hospitals, in the procurement, in the energy sufficiency, isolation, use of plastics, and so on and so on and so forth. And there we have all the evidence, but I think we have to have regulation and incentives at the beginning. The Finns, for instance, have put in place a system of financing hospitals for the first investments, because very quickly, the returns to those investments tend to duplicate. Because you can have the cake and eat it. You can have more environmental policies within a hospital and at the same time save money. And a moment of sustainability, this is a very clear case. The other one, which is one I'm defending today, is also a clear case, but it's taken us a long time. But at least this one, we could have this 5%, I think was the number finally, although there are differences, 5, 10, 9%, could be addressed quite quickly, at least on that part of the greening hospitals, greening centers, transport, and all these elements. I think that's a quick case to do. And I love the idea about labeling. That's really attractive. Hospital labeling, environment-friendly hospitals, big green plate in front of the hospital. That attracts patients, that looks good, looks cool. These kinds of elements actually could get results much faster than the preferred way, which is our way, better pathways, value-based medicine.
But I guess the glass is half full, because indeed a few months ago I spoke indeed to a hospital manager, and he told me, well, if indeed my staff didn't have this during their study, so if they didn't learn about indeed making the sector greener, about how to do joint procurement, that's a start. Secondly, it's also time investment, because they know indeed how to do it the old way. And indeed investing time to do it the greener way requires time and effort and a culture change. So I guess indeed that will come back, and in that respect I noted indeed the people planning and economics, because in the aftermath of COVID-19 you'd hope that that is a message that we don't need to bring home again, but I'm afraid we need to do. So let's spark that thought. But I saw another question there. So can we get the mic here in the front? Here in good. Another question in the back. First in the front, and then later we go to the back. Thank you. I didn't see that.
Thank you, and thank you for this very interesting debate. Boy Eliassen, Copenhagen Institute for Future Studies. I've had the honor to work with Tanya on the COPD index, so we have digged very deep into how to work with this. And one of the reasons of working with indices is also to have a common approach to what are the challenges, so get that message across. But what I wanted to push here a bit is partly what are we looking at? Because we also know that a third of the chronic disease burden is avoidable, right? So reducing the avoidable disease burden is actually the most impactful thing we can do. And this is what we have tried to focus on with the COPD index, for instance, and that part of the work. My home region in Denmark, Region Mid, they are actually embarking on a very, very aggressive approach to reducing use of single-use items and waste with 30%. And they have also admitted that they can't do that without reducing the disease burden, so how much disease comes into the hospital. And just reminding that making something unnecessary green is not sustainable. So first we need to think about what do we really need, and then we need to think about what do we make green in that part. And there we can have the cake and eat it too.
But don't you think we know what's not effective, what is waste already? How many more studies we need?
So the challenge here is not what we know. If you want to change the resources that you use in a hospital, so all the single-use items, you actually need to go en masse with demands to, there is no production for it. You need to go in bulk from the hospital system and say, we actually want this with more sustainable materials. They don't exist today. So that needs to be organized together and work with. That's the challenge they are telling me they have.
Let's park that one, because I think it also comes back to, I think, one of the questions that we got about 3 priority actions. I think that links to your question as well. The question in the back, I think indeed the lady in pink over there.
Hi, I'd just like to thank everybody for this. It's amazing. But my name's Hilary McNamara. I'm with the European Institute of Women's Health. And I'd like to just comment on the last speaker and say procurement and innovation in decarbonisation is badly needed and will help with CSRD next year brought in by the EU. So we have to champion what the EU is doing well. But my question is to Will. He said that he went into the boardroom in 2010. I want to know if he went into that boardroom today, would people make the link between sustainability, decarbonisation and health? Because I see it adjacent in many places and I see it here, but I would like to see it embedded given that next year is 10 years since the Paris Agreement and we really are running out of time, so accelerated action is needed. In Ireland, we have a Sustainability 101 for every healthcare member in the Health Service Executive, and that's training from a bottom-up scenario because information is needed, but it's the people around the boardroom making the key decisions on procurement, innovation, supporting breastfeeding. You know, we need to top down and bottom up. So I just want, my question is to Will, would he feel that the link is there now? Thank you.
Yeah, it's a really good question. And I think with that particular example, I mean, I would say yes. I mean, I worked with that organisation for a long time. And what you're talking about is embedding this in culture at every level. And that's what we need to do here. So people designing health policies, health systems, care pathways need to understand these connections. As I said, those connections aren't being made as clearly as they could. You know, as was said, the greenest intervention is the one you don't have to make, right? So what I say, I often say to people, I think a lot of the work that's happened in sustainable healthcare to date has been what I describe as end of pipe. So if you take the analogy of a factory making machinery or widgets or whatever, you know, it creates emissions, it creates waste. You bolt a piece of technology on the back of the process and that mitigates the environmental impact. Health has been very similar. We've dabbled around the edges, and what we're talking about today is effectively re-engineering the system so that this thinking is embedded. We're not there yet. But we are, you know, we're a lot closer than we were 10 or 15 years ago. I'd say, I mean, I'm optimistic. I'm really optimistic. And we might come on to this, but, you know, the COP26 health program, the ATTACH program, WHO's pushing these national level commitments. It's a really clear indication that this is being understood by the people who make these decisions.
Well, thanks, Will. And I think that brings me also to the part where we said that we also would explore solutions. And I think you rightly mentioned the importance of innovation. So, Andrea, I think that brings me to you. Are there any innovative solutions or strategies that you are thinking of and that you feel may be a way forward?
So maybe we start with sharing some examples, because I think we've talked a lot now about there's an interest and an appetite to find ways to be able to diagnose, treat patients earlier, potentially keeping them out of the hospital as well to make greener patients. And I think it starts with understanding what the pathway already is, right? So we need to understand how that patient is traveling today in order to be able to find the inefficiencies in the system that we can then look to tangibly address. And I think digital solutions do play a role, and we've got examples of that now where we're looking at building efficiencies but with a digital component. And I think we had you mentioned, Joseph, about bringing care to the community, and I think in some cases we've got examples where bringing care closer to the patient, and it might still be in a specific, you know, hub, has got value as well. So one example that springs to mind, again from the NHS, so we need more examples from other places, that's clear, was the project OPERA, which is in heart failure, which is an area that we're involved in as a company. And I think we know that heart failure, if it's not treated again earlier and under control, can result in acute hospital admissions. And about 2% of all healthcare budget is spent on heart failure as well. So it's definitely an area that it's worth looking at. And in this project, Project OPERA, this was a partnership between AstraZeneca and the NHS in Glasgow and Clyde, and now some more partners involved in this going forward. What they did is they took the pathway for a heart failure patient and redesigned it. So they put in place a pathway where they had a diagnostic hub in the community where they used handheld echocardiograms and actually AI. So through doing that, they were able to analyze the results, and then cardiologists were able to remotely then look at the, what's the diagnosis here, what should the treatment pathway be for this individual. And as a result of that, they were able to bring wait times down for these echocardiograms in the hospital from 12 months to 6 weeks. Oh, wow. And in doing so, they were also able to start to show evidence now around impacting less hospitalizations, and also, interestingly, the carbon impact as well. So they showed a carbon reduction per patient through that approach as well. So they're now looking to scale that across the UK, France, Germany, Spain, and other areas outside of the Europe as well. But I think we need more examples like this. Some more tangible examples where we've seen that it's worked. We've got evidence that there's been an impact for the patient, but also from an environmental perspective. And then once we have tangible examples, we can look at how we scale. And it might not be a plug and play in a different country, because as we said, different healthcare systems have different challenges, but there's definitely learnings that we can take that will allow us to have more of these going forward. And I think data is important. Trying to get data on these examples, I think, will help collectively us try and strive for more in this area.
I think that is a very important point, Andrea. I think it's really about the right action at the right level. And indeed, we spoke about the community level. I think, Will, earlier we spoke about, let's say, the member state, the country level. But I think also when it comes to global partnerships, I think in your experience, you have working on these as well. So when we speak about lessons learned and solutions, what can we learn from them?
Yeah, so I mentioned the I think that the watershed moment for this, for me, was COP26 in Glasgow, where my organisation, WHO, UNFCCC, and others really pushed this COP26 health programme, and a collection of countries made public commitments to decarbonised or low-carbon resilient healthcare systems. And that's now become something called ATTACH, the Alliance for Transformational Action on Climate and Health. 85 countries have made commitments. 10 in Europe have committed to net zero. Austria is one. I see Ruperta's here, so good on you. So we have 10 health systems in Europe committing to net zero healthcare over the next 30 years or so. So that's a fantastic start. I think what we've learned, and we developed something called Operation Zero. So the practical approach to that is every health system is different. How do you equip people working in health ministries with a framework, a methodology to actually put those commitments into action, to measure their emissions, to chart a trajectory to net zero? So we created something called Operation Zero. It was a project we piloted with the Netherlands Health Ministry, Portugal, and the Lazio region in Italy. That methodology is publicly available. It's now being used by Belgium and Ireland to create these decarbonised roadmaps. The lessons learned piece is really important. Data is an issue, particularly at a national level, so top down. Hospitals have a lot of good quality data, and you can marry the two, but at a system level, data quality is sometimes a bit sketchy. And skills. People working in health ministries are not environmentalists. So there's a capacity and a need for collaboration between different parts of government. So the health ministry working with the environment ministry, working with statistical analysis bodies, to bring all of this together to actually say what's the problem, where are the priorities, and how can we address them, how can we move forward? So I think they're the lessons we've learned. It's early days, but it's very promising.
But let's perhaps go back to the patient perspective, because I think in all of this it's really important that indeed as a patient, and I know that also from family experience, you're not just coping with different procedures in place that you feel that the healthcare professionals around you are dealing with, but that you're being put in the middle. So perhaps, Tonya, what have we not discussed yet that we absolutely should take into account to do exactly that?
Well, I think we have to, again, invest in empowerment of the patient, right, of the person, because at the end of the day, we're all people. We're not patients, we're people. And we want to get on with the rest of our lives and not think about our chronic diseases that may be demanding too much of our time and coordinating all of the care. So to me, it is about how do we find solutions that really advance that self-management and the entire care team, the multidisciplinary care team. And it is these community-based approaches in some communities that will be much more effective than the central hub and spoke model that has been traditionally employed in large metropolitan or urban areas. So I think knowing the community, knowing what's going to work, but then also putting the proper incentives and penalties in place. I mean, honestly, we have to think about what are the different penalties, punishments, and or incentives that might incentivize the right behaviors. Because fundamentally, we have to change the beliefs that are underlying these behaviors. And I think that that's where, again, the implementation science, unfortunately, of health system sustainability is falling apart. We have failed to really address the fundamental beliefs of individuals that are driving the behaviors. And until we do that, we're going to keep doing the same things, expecting a different outcome, which is simply chaos.
Yeah. Exactly. Let me perhaps go back to the audience, because I think it's a few people that wanted to come in. Yes, I think they're somehow in the back.
Claudia Wild, Austrian Institute for Health Technology Assessment. When you look at hospitals, they improve or try to improve the image with having a lot of technology in place, namely robotic surgery. And robotic surgery, for example, has a large footprint and has not proved to be any better than open surgery or endoscopic surgery. So I would like to echo what the last speaker was saying, that we first have to jump into the brains of the people to reshape the image that only technological-based healthcare is innovative or the best. We need skills to diagnose, etc., etc.
Yeah, one example of that actually is in lung cancer screening programs, where again, there is the very innovative use of artificial intelligence to look at those scans and to realize that perhaps a person was negative on their lung cancer scan, but they have early COPD. And how do we then intervene, get the right patient on to see the right level of care and be more proactive in their care management over time? So I think, again, there are ways that this is happening across the globe. It's just taking those best practices and changing our thinking of the way that healthcare has traditionally been delivered.
Exactly, and I think also bring them in education systems, perhaps, as we said before. Beatrice, are there any online questions?
Yes, we have a question and a reflection from our online audience. And the reflection is that we would also benefit from clarifying what do we need and want to be done. There are high numbers of green labels or recommendations which are difficult to follow by hospitals with limited resources. We need clear messages. So that's the reflection. And the question is, a huge part of the emissions of the healthcare systems concern medical devices and medicines pathways. Is a company such as AstraZeneca ready to act on this change, and how?
So, Andrea, I think this is a question to you.
Yeah, so I think the question around is AstraZeneca acting on this, I think absolutely. So I think one of the examples, well, we've given you a number of examples today where we're working in partnership, and I think this is the key thing, because it needs to be a partnership. You know, a partnership between public and private across different sectors. And I think when we come together and harness the expertise we've got collectively, this is where we really make a difference, because we have inherent skills in these different sectors that can really benefit the collective in these projects. So I think we've given a couple of different examples already, and I think the PHSSR example is an important one, because that shows the commitment to really look at the broader healthcare system, so, you know, sustainability and resilience, which goes a long way beyond medicine. So I think the industry as a whole is certainly committed to this. Let's be honest, the medicines, the medical goods is a small part of the overall healthcare cost. So we need to work much broader if we're going to have an impact on healthcare sustainability. So the simple answer is yes, but we continue to look for opportunities to partner on this.
And it is that co-creation, right, Andrea? I mean, I think about some of the different initiatives that I was speaking about earlier and the awareness tools and resources. I mean, so much of this comes down to getting the right people around the table, thinking about co-creating innovative approaches and solutions, and then investing in those collaboratively. I think that's something that, again, from a patient community, we are very excited to see. There was recently a WHO resolution that says nothing for us without us, basically, throughout all of the efforts in government interventions of sustainability.
Well, thanks for that, Tony. And I think, therefore, it's so important that these experiences, these best practices are translated in policies. And I think, Joseph, that brings me back to you again. And when it comes to the importance of increased investment in health and recognition of the importance of sustainable healthcare systems, how can this be driven within healthcare systems? So again, more at system level rather than purely at patient level.
I find our debate really enlightening and fascinating. And I hook into your point, Tony, about changing behavior. But changing behavior of patients, clinicians, managers, and policymakers. And I think we need to really, the evidence is almost there. Not quite there, but almost there. And I think we need to work at several levels to get that agenda there. The first is the whole area about investing on that for policymakers. One area of work that the Observatory has been pushing for some time now is the area of co-benefits. So it's not only the health co-benefits of the environment, but we go to the environment and say, look, the environmental co-benefits of health and health systems. We go to the economy and say, look at the economy co-benefits of health. Look at the co-benefits of education of health. So I think reframing that can give us some more ammunition and more resources in the health system. It's very important in terms of policymakers. Then the next level is this area of data and evaluation. Listen, I've been asking and engaging in other places, and you guys will tell me, I know the partnership, we're trying to do that. Where are the carbon footprint pathways associated to these interventions? Why I don't get, as a patient, like in some countries you get the cost of your treatment, why don't we get the carbon impact of my treatment? That would make a huge difference. Next, why don't we have HTA evaluation, including the externalities, as we're doing when we fly? Now we are told, when you come to Gasham flying, or by train, look at the negative externality. What about evaluating HTA interventions with a negative externality into the environment? Next, what about introducing this data, this evidence on decision-making tools, your point? Why don't we introduce that? So when you go through as a policymaker, as a manager, as a clinician, you think that through. And indeed, it's been said already, the training. We're involved in a project called Be Well, which we're looking at training packages for the environment as well for digital. And clinicians are so fundamental, and I'm not talking only clinicians as doctors, but nurses and health professionals, in actually getting the environmental message with the patients. So what about training them much better, training policymakers in this area? So these are the kinds of interventions I think could make a difference to make a much more powerful case. And I think we kind of stuck moving in that direction. We need more money, we need more education, we need more evidence, but practical evidence that comes to the desk of the manager, of the clinician. Oh, look, that's my environmental impact. You know, since I got the environmental impact of traveling, I always known that. I always believed in that. But when I look at it, I say, well, actually, maybe I shouldn't go there. It's changed my decision-making. It can change the decision-making of the system as well.
Well, I think it also brings me to another aspect, because indeed you spoke about the need for more data, more evidence, but I think also perhaps in our systems, collectively, we should build in much better foresight, because someone brought up HTA. I recall from the HTA regulation negotiations, which only took place in 2018, so it's still relatively recent, that all the attention went to the clinical and economic benefits of products. I can't recall that the environmental dimension was mentioned at all. And again, I think so exactly. As systems, we're not really, lined up and changing and have that more forward-looking vision. I think that's perhaps also something that we absolutely need to take in mind.
There should be a systematic evaluation of the environmental impact. But let's not forget, that's why I'm excited about this theme today, that even when we're talking about our field, outcomes, health outcomes, quality, we're very lousy. We're not making major change. It's taking a long time. I'm sure, Tony, you can tell me 10 right now of evidence-based practices, value for money, and someone was saying healthcare variations still are not adopted. So I'm hoping that by putting environmental impact, we get a bit more track and push and pressure on better value-based medicine. Because so far, HTA hasn't had the level of impact, neither on purchasers, neither on clinicians, on what they should be doing. So I think we have to go back at our souls. Why are we not making enough change?
Exactly. I think, Andrea, you wanted to come in as well?
I was just going to comment on two of the points you made. One was around, the fact that this is difficult, right? I think we appreciate it's difficult, but often the most difficult things are the most rewarding things when we do them. So it's actually biting the bullet and going for it in terms of making that change. And I think your last point around the education piece, and Will talked about it, is important because you asked an insightful question earlier to Tonya about who was the change agents. And I think that's the point. We want more change agents because often it's individuals or it's academic centres or it's a certain hospital within a healthcare system that really believes in this and wants to do something about it. And they become the change agents that help catalyse the partnerships then. So I think these are important points and fundamentally the point around policy though, because we really do want to start harnessing this consideration of the triple win, I think you described it, Tonya, the win for people, also patients, in addition as the healthcare economic benefits and the environment. So I think you're right, Joseph.
Thank you. I like that.
Good.
Good points.
I think we have questions. So let's indeed take perhaps these two questions and then we go to a ranking exercise because I think slowly also we come towards prioritizing actions. But let's go to the question first. Yes, please. I think there.
I'm Adrian. I'm from Medicines for Europe, where we represent manufacturers of generic medicines. Procurement was mentioned. I don't understand why we don't just move towards mandatory environmental or climate criteria into procurement. A few years ago, I think it was Healthcare Without Harm, but it might have been another environmental group, identified or made very serious allegations about some antibiotic producers polluting waters at production sites. And this caused a big shock in the industry, and now there's a standard to prevent this kind of thing. Although the companies alleged to do this are not part of the standards or are not subscribing to it. But the funny thing was, how were these companies supplying the market? Well, actually, the biggest buyers of medicines in Europe, the NHS, the German sick funds, the Dutch sick funds, were buying almost exclusively from these companies. So, if we put in place criteria, greener criteria, you could, let's say, again, these are just allegations, I can't confirm with these things, you could at least eliminate some of these bad apples. And I note, for example, for the industry standard we have from antibiotics now, only Norway uses this in its procurement. No other European country does this. So, it's just an example of where things have maybe not gone so well, but where procurement has not really adapted to try and improve the situation.
Well, thanks, Adrian, for that question. So indeed, forcing change by making requirements mandatory. Will, what would you say?
Yeah, I mean, procurement's one of these sort of like keystone issues, isn't it? It's 60%, 70% of the carbon footprint. And as you say, there's all these other environmental consequences, particularly around pharma. It was a Healthcare Without Harm effort, I think you're referring to. And we have published guidelines on how to procure for greener pharmaceuticals. The NHS, interestingly, has, coming back to the NHS again, really do need to find some new examples, don't we? But the NHS, it's specific on this point, the NHS has now said to its major suppliers, and it can do this because it's as I said, it's a centralised system that buys a lot of stuff in bulk. If you want to trade with us, if you want to sell into our market, you will meet our carbon reduction targets and you will report on it. So that was introduced a while ago for major suppliers, I think £5 million plus procurement. And I think from this year, it's being rolled out universally. So it is happening, but obviously not as quickly as we'd like.
Thanks for that, Will. What I propose, because we're going to do a ranking exercise, and I've been told that it takes about 10 minutes before we actually have the results of that exercise. So I propose that we first do the exercise, so you come in with your suggestions for action. Then indeed we go back to the question, because I believe there was an additional question. And then at the very end, I think the outcome with your input, I think is a very good way of concluding this session then. So I believe, again, you just go back to Slido, and I believe from then onwards, indeed, you should be able to provide your actions to be prioritized. So I give you a few seconds to indeed provide your answers, but perhaps the person who wanted to ask a question. So perhaps indeed we can already get the mic to you there just in the back, so that we're all aligned when everyone is ready.
Thank you. My name is Ute Müller-Karstenjen. We do health communication in Austria, and I want to come back to the point of investment in prevention. And my question is, why is it that the investment in prevention is so small over all countries? Is it because we do not know what we should do, or is it that we need to change our culture on that? So my brief question on that is maybe naive or maybe very straight. What would you think about a commitment of all member states on the EU level for a mandatory percentage to invest in prevention?
I believe, Joseph, that may be a question for you, because I know that the Observatory has done a lot of work on prevention. So indeed, the question is, why are our budgets so small? And indeed, could more be done collectively at EU level?
That's not a naive question, just come from a podcast where we had the same question, the same debate. Well, the 3% to me is a red herring. It's very important. It's very important. We should invest far more within the health system. What the 3%, I was with Francesca Colombo of the OECD, and we were looking at that data. What does it mean? It has increased now, it's a bit higher. But still, and it proves that there's not enough on prevention within the health system. But really, like on the issues today we're talking about on the environment, we have to look at the real determinants. And yesterday in plenary, it came up, the commercial determinants of health. 1/3, I know you know that, but I'll say it again. 1/3 of preventable, 1/3 of overall deaths are preventable. 1/3 of deaths, 1/3 of people dying is a lot, are preventable by dealing with 4 industries: tobacco, alcohol, food processing, and processed foods rather, industry, and fuel industry. And we know what to do. I'm asking you back, why are we not doing it? It's not a naive question, why don't we do it? We can talk about why some EU legislation and our colleagues at the Commission, whom I admire, pushing like crazy, are slowed down. We can talk about beer producer countries, whose names I forget now, forbid any health warnings in the bottles. We can talk about why we're not forbidding children advertising, digital media. That's what prevention is about. It's not only the 3%, which is important. Why is not happening? You can give me the answer. That's the political economies, what was said yesterday in the plenary. This is what we need to talk about. The 3% is important. Has to be 10%. More PHC, more public health in PHC, more screening, more secondary prevention, more health education, you name it. But we are not barking to the right tree. And we are here in the EU. The Commission has all the tools: internal market, trade, agri, competition. We should be in the Parliament today, the European Parliament, discussing these issues. I'll leave it here because it's too obvious what I'm saying.
And I'll just reinforce, it's about beliefs and changing beliefs of the next generation around those topics. And again, putting policies in place that shape the beliefs of the next generation when it comes to tobacco, alcohol, healthy food, clean air. I mean, again, if you think back to, for me, 50 plus years ago, today is my birthday, in my education, there was nothing mentioned nothing around those topics.
But Tonya, can I challenge you?
Nothing.
The Z generation is smarter. They don't drink. I have a couple of Z generations at home. They drink much less, and they look at my drinking patterns, by the way, which is very nice, by the way. But is it education? Commercial determinants companies have larger GDPs than a third of the countries in Europe, some of those. Food processing companies, food producers, fuel, you know, who's made a lot of money recently, you know, the fuel companies. We talk about the environment. They have the power, they determine the agenda. If we're not prepared to work together as governments and steer that, you know, education is one way to go. I agree with you.
Education, but also penalties,
Okay.
taxation,
All right.
penalties,
That I like.
using those resources in more effective ways. I mean, again, I point
Yes.
to countries like Finland, where they've had a very aggressive tobacco policy and are moving toward a smoke-free society. Others, again, made strides in that area and then retracted. So we need to be consistent in reshaping the beliefs of the next generation.
And the new government in Finland is killing the monopoly of alcohol, probably. One of the most cost-effective interventions in... So you see the waves. Finland at the very leadership still in health promotion, now they're considering to kill the monopoly on alcohol, which is a great cost-effective practice.
Yeah.
That's what depresses me somehow. I'm an optimist like you, though.
Yeah, but I think, Finland, I think, is also the excellent example where already
Yes.
the decision to take a much more holistic approach with a focus on the well-being economy was taken much before. So I
Yes.
think awareness, change-making, changing culture is all related. But I'm conscious of time because I feel that indeed we can go on for another hour, but probably then the next session is going to wait for us. So what I do, because I think that in the meantime we should have the results of the ranking exercise, but after that, just very briefly, I would like to ask all our panelists perhaps for their preferred action so that indeed we all end the session with a collective view on the way forward. So let's go indeed to the ranking exercise. Actions to be prioritized by the audience. I believe we have 4. I see some of you still working on your phones, but I propose that in light of time we take these as the final ones. So launch an EU roadmap supporting member states to design and implement sustainable care pathways. Then the mandate that new EU policies undergo a sustainability and health impact assessment, including patient metrics. And I think that is important because we spoke about the importance of measuring what we do. Another action, the third action, is provide technical support and funding to member states in complying with an environmental standards that promotes public health. And the fourth is establish a European joint expert group. It's always a favorite solution, I think, to have expert group at EU level, but an expert group dedicated to producing guidelines and policy recommendations on reducing emissions and waste in healthcare systems. So again, we're speaking about a roadmap, a sustainability health impact assessment, support and funding, and an expert group. So I think these are indeed the tools that we usually have at our availability in Brussels. So I think it's well noted, and I also propose indeed that as the organizers of these sessions, we take these forward and also try indeed to work on these going forward, all in our, I think, respective workplaces. So I think that brings me to you as our expert panel. I think we already talked a great deal about the scope of what we're talking about today, but also indeed about best practices. So indeed, having listened to the audience and to our panel exchange this morning, Tonya, I start with you, because I never know, is it best to start with the patient or end with the patient perspective? Probably both. But indeed, I start with you, your takeaway and your some sort of number one action.
So I think it's a really challenging coming down to one thing, but I will reinforce that I think that fundamentally we must co-create solutions that affect beliefs and behaviors. And I'm not sure, I think all of these are great suggestions, but I'm not sure any of them fundamentally change the belief system of cultures to prioritize healthcare, not sick care, healthcare. And I often say, if we want to run fast, we run alone. So we all can go back and do our individual things, right? And advance our cause, our passion, our purpose. But if we want to run far, we must do it together. We must find these types of forums to come together to respectfully discuss the challenges of the different stakeholders and come to real solutions that will effect long-term change.
Thanks, Tonya. Joseph.
Tony, after having challenged you earlier for the pleasure of the debate, actually, I think in moments of depression and optimism at the same time, I believe that the only way is in the new generations and education, that they would come out there and they'll be activists. For now, so I totally agree with you, number one. Number two, for now, I should say expert groups and books, because that's what we do. So as observatory, and we do very good studies and good policy briefs, and we do knowledge transfer, but actually the important one, I think, is health impact assessment, but linked to strong regulation and empower the EU. Because actually the capitals are quite, not Britain unfortunately, but the capitals are quite happy about blaming Brussels and getting Brussels to do the things they cannot do. So having the power of Brussels with this health impact assessment, well, it's Brussels, it's not us. But we have to do it, because it's in their key. So I think health impact assessment linked to regulation could be of your fourth, to me is the one I voted for.
Thanks, Joseph. Andrea.
So I agree, it's very difficult to pick one thing, right? I liked the question we got from the audience around why aren't we just doing this? So I think there is a piece here around European policy and how we can really make sure we are guiding around this earlier diagnosis and guideline-directed treatment, particularly in certain areas. I know cardiovascular disease is on the agenda right now, and we need to look at that in an integrated and holistic fashion, because so many of these diseases are actually interlinked. So if we tackle it in one place, we can actually have a broader impact. And I know, your EU's already looking at how we can beat cancer. I think taking that to the next level and thinking about lung cancer and other areas could have a meaningful impact too. So I think there's an opportunity at a policy level. And then I would encourage us to continue looking at a member state level on this resilience, this sustainability and resilience, and then doing something on the back of the data. We really need to act. The data is one part, but we need to act on that data. It might be difficult, but we have to do it if we really want to have an impact. And then the last thing I'd say is partnership. Partnership, partnership, partnership. I think we can achieve so much more together.
Thank you so much, Andrea. Will?
We're over time, and I really can't add it. That was an excellent summary. I would just say this is about culture and collaboration. Culture and collaboration, I think, is what will make the difference here. So I'm not going to add anything more to what was said. I think that was a really excellent summary.
Well, many thanks to all of you. I think this was a really important session, not only because of the fact that it's very timely, but also I think the collective call for culture change. I think all of us need to leave this room with the idea that we're all change agents, and I think very much linking to what you all said, not just in an individual setting, but I think collectively. But I think that is very important. And indeed, in Brussels, at EU level, indeed, although it's blamed very often, I think we're going to prepare for an interesting mandate where I think the nexus between health and environment is now more than ever explicitly acknowledged. So let's hope that also concrete regulations will be in place, and that despite some skepticism in Brussels that perhaps health is not as strategic as it could be, it will be play a bigger role in the different portfolios and not just in the health directorate. So I hope indeed to see more of it. I really would like to thank all of you. I would like to ask for an applause for all our speakers, but perhaps an extra applause, so that makes me then end with a patient respect for Tonya, because she was here on her birthday. So I really would like to ask an applause for all our speakers. Thank you. Well, thanks, Will, Andrea, Joseph, and Tonya, and have a good rest of the day, all of you. Well, thanks to you. Yeah, I mean, thanks. Can I perhaps leave this first?